Zoumaras, plastic surgeon here at Artiste Plastic Surgery, and we're continuing the discussion today on rhinoplasty. At Artiste Plastic Surgery, I offer four main types of rhinoplasty surgery, all with the end goal to improving the shape and size of your nose, so you're confident in your nose from every angle. So the first operation is what I call a shape nose. Second is a profile nose. The third being a total nose, and the fourth being a total plus or a revision rhinoplasty. As a face expert, I often do complicated rhinoplasty, when it's been done once or twice before. Now, with a shaped nose, it's a pretty straightforward procedure. What a straight nose involves is removing the bump on the dorsum of the nose. So most patients have a large bump on their nose in which we just shave it down. You still need to have a formal rhinoplasty for this operation, and I call that a shaped nose. A profile nose is where we're not only taking the bump off the dorsum of the nose, but we're actually reshaping the tip a little bit. And that's what we call a profile nose, because we're changing the shape of the dorsum and the tip. When we come to total nose, we're talking about doing rhinoplasty surgery for breathing, for the shape reason and the profile reason. So in other words, we're improving the breathing, we're taking the bump off the nose, off the dorsum, we're reshaping the tip, and we may or may not also do nostril surgery. When we're talking about total plus surgery, this is a patient that's had previous rhinoplasty surgery and they're not quite happy, or they've had basically a nasal collapse and they need to have their nose reconstructed. I do the revision rhinoplasty surgery always using rib grafts. So I use the patient's own rib, where I actually sculpt the rib into the cartilaginous structures of the nose. Because when you're doing revision surgery, the first thing to do is actually make sure that the nose is stable. So we stabilize the nose. Once we stabilize the nose, we can reshape it. If you do revision rhinoplasty without stabilizing those, the result will not last. And that's the reason why we use rib grafts. So in a nutshell, there are four options for rhinoplasty surgery, and which option is suitable for you really just depends on what you want to do to your nose. One of the many reasons people come to me for a rhinoplasty, as I mentioned, is to take the bump off their nose, to make their nose smaller, to improve their breathing, and to reshape their tip. But overall, they just want more of a refined nose. So if you think you're in one of those categories, please give us a call. I'd love to discuss your rhinoplasty surgery with you.